To understand right heart failure. So here we have right heart failure. So here's the idea. There's the lungs, there's the left heart, there's the right heart, right? There's the body right over here. And this is the right heart right over there. Then we have this body, right? So right heart is failing, right? If right heart is failing, then we will have some sort of, increased pressure in the body, right? Because right heart is not able to push the fluid from the body to the lungs, right? So we'll have some sort of buildup in the body, right? And we can call it as edema of the body, edema of the extremities, whatever you want to call it, right? So that's the idea. So right heart failure, right? And it presents with systemic finding. Why systemic? Because the body is being affected, right? We have jugular venous distension. Now there's a concept between this jugular venous distension and, so I want to go a little bit inside between JVP, that is the jugular vein pressure, and JVD, that's the jugular vein distension. Now let's first go into this JVP. Okay, now this is the height of visible vein column, the blood of, there's the blood column right there, right? That's the column. For example, I make the cylinder, and right in the cylinder we have this column of blood right here. So we can see this column of blood, and we see this column of blood at right centimeter, sorry 3 centimeter above sternal angle, right? So I make this neck, right? This is my head, this is my this is my hair, these are my eyes, this is my sternum right there. Okay, I'm making a sternum. This is my sternum. So right 3 centimeter, that's 1 2 3, about here we'll see this column of blood. Now once this column of blood we see, this is normal, by the way. Okay, so this is normal. If this column of blood goes up and we see this column here, then we can say we have some sort of distension. Okay, so this is normal. So normally we see this column of blood 3 centimeter above the sternal angle, and we call this JVP. And JVD is distension, right? Now due to distension, why there is distension? Because there is some accumulation of blood, so this jugular vein, it also flushes inside this right heart, and then right heart pushes the fluid inside the lungs, right? So the right heart is failing, so the fluid accumulation will happen in this this in this vein as well, and then we'll have some sort of distension, right? So due to the distension, the column goes up and it goes more than 3 centimeter. We call that JVD. Okay, so that's the concept here around JVD. JVP and JVD are different things. Okay, so that's the concept here. So we have jugular vein distension and we have peripheral edema. Peripheral edema because we have some sort of fluid accumulation in the body, because right heart is not pushing the blood which was supposed to be pushed inside the lungs. Since the blood cannot enter the right heart easily, it backs up in the neck, JVD, and the venous circulation, right? Increased hydrostatic pressure in the veins, and then we have transudation of fluids into the legs, right? We have edema in the legs. And the question might mention that we have central venous pressure is high. Now, when I say central venous pressure is high, central venous pressure, CVP high, it means the fluid that was supposed to be flushed in the right heart is not getting flushed, right? So we have increased pressure in the body, right? What will happen? Well, if the CVP is high, it means the renal vein pressure is high as well, because, so here's how it happens. So this is my central vein, and we have these parallel connection to this is kidney, for example, this is superior mesenteric artery, this is inferior mesenteric artery, and these connections are on parallel. These are not in series, they are not connected like this. That, for example, okay, this is my this is my kidney, and then this is my maybe liver. It's not connected like this. Usually it's connected, this is the central vein, and then we have these kidney, then we have liver, stomach, this connected like in parallel circuit. So that's the idea. So if we have congestion in the central corridor, we're going to have less flow in the kidney, we're going to have less flow in liver, we're going to have less flow in the stomach. So we'll have congestion everywhere, right? Because the central vein is getting affected here. So transduction of legs, right? Of course, edema. The question might mention that we have increased pressure, right? So increased CVP, that's the central vein pressure, equals to increased renal vein pressure. Then we will of course have less GFR. Once we have less GFR, the RAS system will be activated, and then we'll have compensatory mechanisms due to RAS. Okay, simple stuff. Okay, so again, other stuff is that we have hepatosplenomegaly. We have increased size of liver and spleen because liver drains into inferior vena cava, right? Now, if our central vein pressure is up, the draining system will not work very well, right? So if CVP is up, hepatic vein pressure will be up as well, because the liver is not able to drain into inferior vena cava well, right? Because the CVP is way up, right? So if the hepatic vein pressure goes up, the back, sinusoid, they will stretch like a tiny balloon. And we can have two things happening. First, we can have fluid leaking into peritoneum, right? So we must check the peritoneal cavity for any sort of fluid leak, right? I think we call it paracentesis or something like that. I don't remember right now. So we can check that. Other thing we can do is we can go for hepatomegaly, right? It's gonna lead us to increased size of liver, because we have pain, we have problem in the central vein, right? And this will present as pain in the right upper quadrant of our stomach, because liver capsule stretches, right? And then it can come as nutmeg liver. It can show as nutmeg liver due to chronic conditions, right? Chronic increased central venous pressure, right? Now, why splenomegaly happens? Because the portal vein system swells up as well, right? Now, what is portal vein system, by the way? So here's the thing. This is my liver, right? This is my maybe intestine, right? So intestine, right? So usually what happens is the liver produces the bile, and then this bile is sent back from the intestine to the liver as a recycle, and this is recycled like 6 to 8 times per day. And this is very important because producing liver is a very expensive job for our body. It's really ATP extensive job. So once we have, so body doesn't want to produce bile every time new, because it's expensive. So what happens is that bile is getting recycled every a lot of times. So the vein that puts the bile from intestine back into the liver is portal vein. Okay, so once our portal vein is congested, we'll have some sort of buildup in the intestine. And, not surprisingly, spleen is also part of this portal circulation. So again, our portal vein is congested, so our spleen will, size will go up. So that's the idea here, right? So why splenomegaly? Because portal system swells up due to increased pressure in the portal vein, and we see increased size of the spleen, right? So that's the idea here. Okay, cool thing, right? So we see hepatosplenomegaly can also be seen in right heart failure, of course, which is very rare on U-assembly. Normal jugular venous pressure, that is JVP, is around 3 centimeter above the sternal angle. Okay, JVD would be higher than this, of course. Sometimes question can write that jugular vein pulsation are seen as 3 centimeter above the sternal, and students erroneously think that this means JVD, but this is not the case. So here the author is trying to emphasize that JVP and JVD are really different things, okay? Because JVP is just normal, that's above 3 centimeter, and JVD is the distension due to right heart failure, okay? So that was right heart failure in a nutshell, in a very small way, and this is really high yield, so you can solve question on that, I think. And okay, I'll see you in the next video. Next we'll cover congestive heart failure. Congestive is just both left and right heart getting messed up. Then we can check for cor pulmonale. That usually has to deal with lungs. Then we can go for bilateral pit. Okay, so I think in this video, I think just right heart failure is good, right? So have a nice day, have a nice weekend, whatever you want to do. Pakka. До свидания.